Greetings, SOPHE members, annual meeting attendees, and distinguished guests. My name is Dr. Amy Thompson, and as the Society for Public Health Education president, it is my privilege to introduce this year's Honorary Fellow Awardee, Ms. Catherine Coleman Flowers. The Honorary Fellow Award is SOPHE's highest award to a non-member who has made significant and lasting contributions to health education and public health. Ms. Coleman Flowers, your work as a researcher, activist, author, and as the founder of the Center for Rural Enterprise and Environmental Justice has literally saved the lives of countless individuals living in poverty and without basic public health infrastructure, the basic public health essentials we take for granted today. Just a little more than a decade ago, you brought to national headlines the shocking environmental degradation and raw sewage in yards and waterways and contaminated drinking water of rural Alabama residents. In the spirit of community engagement and multidisciplinary collaboration, you were able to eradicate the vicious cycle of poverty and disease so that residents have access to modern waste treatment and clean water. Your testimony to the U.S. Congress led to the introduction of legislation to address environmental diseases and shameful public health conditions in rural U.S. communities. Ms. Flowers, your books, presentations, and testimony are truly examples of the power of one voice that can change the world. Your tireless efforts as a public health advocate and MacArthur Genius Award recipient inspire us as health educators to continue to the march for environmental, economic, and social justice for all populations. For all these reasons and many more, SOPHE is pleased to name you as its 2023 Honorary Fellow. We welcome you as a lifetime member of our SOPHE family. Although you cannot join us in person at our SOPHE conference in Atlanta, we look forward to your inspiring remarks today.
Thank you so much, Dr. Thompson, and thank you, SOPHE, for this honor, which will continue to inspire me as I do this work and try to inspire young people from around the country to be concerned about health and educating the communities in which they serve. I think that this award and the timing is very accurate because as we look at the struggles that have been laid bare by COVID and fighting the pandemic, this is truly the new age of civil rights advocacy and equity. And I am, again, honored to receive this award and also honored to be able to be a lifetime member, which I will like to be an active lifetime member. Thank you so much. So as we look at where we are today in terms of health education, I'd like to start off by acknowledging those teachers that were a part of educating me about health and making sure that as I worked in the community and I saw things that were indicative of problems around sewage, that I was able to recognize it. So I'm very thankful to those teachers from Lowndes County, Alabama. I think it's also a good time because there is currently a movie that I would like for everyone to see if you're interested in the work that we're doing. It's called Lowndes County and the Road to Black Power, that talks about the political fights that happen in Lowndes County around voting, because voting is part of, in my view, health education, but it's also part of what we need to do to move the needle to make sure that everyone has equitable access. There is also a book by Dr. Hassan Jeffries, who is at the Ohio State University, that is called Bloody Lowndes, that tells a lot about the history of Lowndes County. Again, as we juxtapose it against health and a lot of the health inequities that exist in the area and throughout this country, I think it'll help us to understand what work must be done. But I'm going to start off by really telling you about my story and how I became engaged in this effort and this fight. It started because in 2002, I was called to a site because people were being arrested because they could not afford on-site sanitation. I was not aware of that at that time. I had just moved back. I'm a teacher by profession, although my subject area was history and social studies. Those liberal arts skills that I learned were very applicable when I started applying them to advocacy. And the way I got involved is that I found out that the people that were being arrested were poor and really could not afford the remedy, which was on-site sanitation. But even later, we found out that on-site sanitation was failing, and it was creating a lot of conditions for disease. But when I was called to the site, I didn't realize then that we were sitting on top of a power cave. But there are so many communities around the United States where people do not have adequate sanitation, or they have failing systems. And now when you add climate change to that, it's making it more dire for a lot of communities. But in Lowndes County at that particular time, and this was over 20 years ago, we were able to stop the arrest at that time of people that were being cited. But we also had the opportunity to examine and use academic methods to figure out what was really going on. But in doing that, we used the principles of environmental justice and work with the local community to define what the problem was so we could understand what the solution was. Later, I was called to the home of a woman who was pregnant, and I write about it in my book, Waste. She was pregnant and she had one child that was autistic. And the health department at that time was threatening to put her in jail because she could not afford on-site sanitation. She lived in a single wide mobile home, and I could smell the sewage sitting in her home, and obviously she couldn't smell it because she was just accustomed to it. Outside her back door was a pit, and in that pit was all of the remains of the sewage that was coming from her house. And on top of that pit were mosquitoes. It was teeming with mosquitoes. At that particular time, I was wearing a dress, excuse me, and I had on hose, but those mosquitoes were so bad they bit me through my hose. And I ended up developing a rash. Went to my doctor because I knew that it was not safe. I had learned this in health many years ago while I was in high school, that for mosquitoes to be sitting on top of raw sewage, that was not a good thing. And the fact that they bit me and drew blood, I knew that there was a possibility that I could have had some kind of ailment from it. And of course, this rash was indicative that something was wrong. My doctors could not find out the cause of it. All of my blood tests came back with nothing being wrong, but the rash was evident. So I asked my doctor, is it possible that I could have an illness that American doctors were not trained to look for because the assumption is that there is no raw sewage on the ground in the United States of America? And she said yes. From that, I started to wonder and mull over what could this potentially be. And a few months later, there was an op-ed that was in the New York Times that was written by Dr. Peter Hotez, who is the director of Baylor's National School of Tropical Medicine. And Dr. Hotez, I reached out to him through the internet, never talked with him before, but he responded to me when I explained to him what I was dealing with. And I asked some scientific questions. And one of the questions was, is it possible that there is some diseases, tropical diseases in the US that American doctors are not trained to look for? And he said yes. Out of that contact, he sent his parasitologist to Lowndes County, where we collected fecal, soil, water, and blood samples. And from there, we were able to determine that there was not only hookworm, but strongyloides and other types of tropical parasites associated with raw sewage were evident either in the blood or the fecal samples of people from Lowndes County, soil and water samples as well. And it took 3 years for this to be peer reviewed. But once it was peer reviewed, it made international news because these were issues that we should not expect in a country as wealthy as the United States of America. But these issues around sanitation and water are prevalent throughout this country and around the world. But in particular, we're finding it in environmental justice communities, poor communities, rural communities. The rural communities where I've seen raw sewage and have heard about raw sewage issues have been from Appalachia to Indiana to Central Valley to New Mexico to Hawaii, Puerto Rico, throughout this nation. This is a time for us to address it. Climate change is making all of these things worse. And as we saw during the COVID pandemic, that the people that had the highest rate of infection, and we saw the highest death rate per capita in the state of Alabama were from Lowndes County, Alabama, and no wonder. We also found out that in Lowndes County, Alabama, that there were people who are paying a wastewater fee because of failing systems. Sewage is coming back into their homes. And those were the people that had the highest volume of parasites in their systems. We have to find a better way to deal with this, and health education is one way, one of the many tools in our arsenal that can help us get to the justice that we need. As we look to issues around sanitation and water, we're finding that the government, the federal government, is now paying attention. Through the bipartisan infrastructure bill, there are now millions of dollars that are in place to help rural communities. In August of 2022, the President of the United States saw an article where I was quoted. Actually, he was making a visit to Georgia to look at voting rights, and they're in the state of Georgia. And this New York Times article that he was reading, I made the statement that the only way we were going to get to sanitation equity was the way we got to voting rights, which was through federal intervention. And after that time, we ended up getting visits from the infrastructure czar, the USDA secretary, and the EPA administrator for the first time ever to do a program that they call Closing the Wastewater Access Gap Initiative, which will be in rural communities throughout the United States, because I submit the rural communities are also environmental injustice communities. A lot of them have been left out in terms of infrastructure and investment. And that's why a lot of rural towns are dying. We also see a lot of problems with addiction in rural communities as well. And there are no jobs or any meaningful way in which young people can stay in a lot of these communities because of the disinvestment. But on the other side of this, we know with climate change, a lot of people are going to have to move. And where are they going to move? They're going to have to move to these areas that are now rural. So this is an opportunity for us through the bipartisan infrastructure bill and through the Inflation Reduction Act to be able to bring things to those communities, the infrastructure and jobs to those communities. They can improve health and well-being, the overall well-being of residents, so that we can get to the justice that we are trying to get to. And that's I think that's our new civil rights fight. But it would take advocacy. You know, if I, as one person, can do what I've been able to do, just imagine what if everyone that lived in rural communities or in urban communities that cared about these problems would put some time and effort into bringing about the type of policy change that is necessary to help people get to better health and well-being. And in doing so, people will pay attention. My life and what has happened is a testament to that there's a way for us to get people to pay attention to these issues. Recently, I attended a conference in Miami, and Miami is one of those areas. The Miami Beach area, of course, is in the crosshairs of climate change because of sea level rise. And there, people, I thought that we would be the only ones talking about septic systems, but they're failing there as well. And we have to find ways in which to address these issues. So the solutions that we are focusing on through the Center for Rural Enterprise and Environmental Justice is that we're looking for non-traditional partners in order to find technological solutions. One of the ways in which we are grappling with this, we actually moved our offices from Montgomery, Alabama, to a historic area, to another historic area in the Huntsville, Alabama area. What people don't know about Huntsville is that there are a lot of science. There are probably more scientists and engineers per square mile in Huntsville than anywhere else in the Southeast. In addition to that, Huntsville has a very illustrious history as it relates to science. During World War II, a lot of scientists and engineers came from Germany and settled in this area. So you would see the remnants of that in a lot of the streets that are named with German names. But those scientists and engineers were also part of putting together the missile program at Redstone Arsenal, which evolved into NASA. And we thought if we could look to NASA and what NASA was doing and figure out how we could use that to help improve what we have here on Earth. Because part of NASA's mission is finding out how to use their extraterrestrial knowledge for the greater good here on Earth. So in doing that, we upped and moved our offices here, and lo and behold, we're able to connect with people at NASA because one of the NASA engineers is actually a neighbor. And after hearing about the work that we're doing, agreed to help connect us to the right people. We visited their campus, and once we went there, one of the things that we saw is they have learned how to take urine and turn it into drinking water. And in doing so, we felt that we could merge what we know and what we have learned from the communities in which we've worked with what they've learned and try to come up with a new way to treat wastewater. And that's one of the projects that we're currently working on. We're also working in academia with the University of Georgia. We have a grant pending where we're trying to figure out ways in which to predict the failure of wastewater infrastructure. As we look at Jackson, Mississippi, and what is happening there, a lot of climatic events combined with systems that are just not working within our new reality created the problems, the crisis that is occurring there. And there will be other Jackson, Mississippis if we do not put in place resilient and sustainable infrastructure. That is why health education is so important, because it's connected. Without sanitation and water, people will get sick, and it will mean that it will have an impact on us just as bad as COVID, if not worse. So I am very, very thankful for the opportunity to be aligned with SOPHE, and hopefully in the future, working more closely in trying to find solutions to these problems. Because in order for us to get to the justice, we have to have the advocacy, and we have to keep this march forward toward having the kind of equity that all of us need, whether you're in a poor community, or if you are in a rural community, or if you're just a person that's under-resourced and overburdened. The last thing I like to offer is for SOPHE members to tune in and pay attention to the White House Environmental Justice Advisory Council. I am honored to be the co-vice chair of the White House Environmental Justice Advisory Council. And we have public meetings, and there's also an opportunity to present public testimony. So please tune in, because the communities where you're working, they need you to represent them if they are unable to represent themselves, or to back them up by attending these meetings and also presenting testimony. And we look forward to your insight, because there are things that you've seen that can help us with the advocacy and can also help us get to justice. Thank you very much for this opportunity, and I look forward to further collaboration in the future.
Thank you so much, Ms. Coleman Flowers, for that empowering message. Truly amazing, and the work that you do is inspiring. If I may, I would like to ask you one question, though. The CDC has established recently an Office of Rural Health. I'm wondering if you could comment on how SOPHE might be able to work with that office based on your experience.
Wow, that's a great question. First of all, I applaud CDC for actually launching an Office of Rural Health, because a lot of rural communities are without health care. And oftentimes people wait before they seek health care because they may not know that they're dealing with an issue that can ultimately snowball into a crisis. So one way in which I believe that SOPHE and CDC can work together is by educating people in the communities about what to look for, when to seek medical care, what to stay away from. I mean, people that are in communities like, for example, East Palestine in Ohio, right now that is struggling with a chemical spill. They're going to need a lot of education about when to consume the water, whether or not the soil is good. What should they be looking for in the animals that's indicative of something could be wrong, or what kind of symptoms they should be looking for as well themselves. And I think even SOPHE members could be very helpful in terms of educating people about citizen science to help CDC do its job. You know, one of the examples in our story is that we were able to collect people's soil, water, and blood samples. And there were a lot of, in order to do that and to get the trust, in order to do it, it had to involve people from the community themselves. And I think SOPHE could be very, very helpful, because a lot of SOPHE members come from some of these communities. And that makes it easier to do the work and to build the trust.
Thank you so much. And I know there's someone special you'd like to acknowledge today.
Yes, I would like to acknowledge, I'm so proud of my cousin who is accepting this award on my behalf, because I'm unable to be with you in person, but Dr. Antonio Gardner, who is also a member of SOPHE. So I'm so proud of him, and I'm glad that you've embraced him, and I look forward to continued collaboration.
Thank you again.
Thank you.